Let's talk about a little bit of physics first. So diffractive optics is based on the wave nature of light. Waves are generally have the ability to interfere with each other. So basically in diffractive IOLs, there is an aspheric lens and a structure with zigzag sharp edges placed on the lens, which is called kinoform. And this kinoform intentionally induces the diffraction so that the waves exiting from the lens will form constructive and destructive interference. Constructive interference gives two foci, one for distance and one for near, and destructive will give rise to loss of contrast. So how much light energy will go for distance and how will it go for near is mainly governed by the height of the steps. Some percent of light will not be diffracted at all. That is called zero order diffraction, and it is mainly for distance. Some light will be diffracted into first order diffraction, which is for near, and remaining as shown here, the 20% light is diffracted into higher order, which causes halos. And coming to second part, the width. The width of the steps determines the addition power. Smaller the width, more the addition of power, and larger the width, lesser the addition power. In trifocal lenses, there is basically combination of two diffractive structures, one for near and other for intermediate. In triphobic HD, there is a combination of plus 3.5 and plus 1.8. So decreasing step height and increasing the angulation from center to periphery ensures good light distribution in both mesopic and photopic pupil, which is commonly called as apodization. So coming to our case, this is a 60-year-old female with nuclear sclerosis grade 2. Her pre-op vision was 6/18, and her pre-op evaluation showed good corneas, like on her topography, higher order aberrations, spherical aberrations were all within normal limits. Her angle kappa and alpha were within 0.5 mm. And it is very important to get 5 to 5.5 millimeter of rhexis well centered on the visual axis, as just mentioned by Dr. Patwardhan. The patient is basically asked to look at the microscope light, and the first Purkinje image, which is from cornea, is taken as the center of rhexis. I always perform multiple hydrodelineation in soft cataract to assess the nucleus grade and size. The nucleus is chopped using very little vacuum and energy. Since it is a soft cataract, chopping is little tricky here. Then the heminuclei are phacoaspirated one after the another. So triphobic HD is basically hydrophobic acrylic trifocal lens. It has fewer rings, so that makes it less prone for glare and halos. It has biconvex optics with modified C-loops haptics. So after finishing the bimanual irrigation and aspiration, I always implant lens under continuous irrigation. That makes visco wash very easy. And the last and most important part of the surgery is centration of the lens. The center of the optics has to be coincided with the first and third Purkinje images. The first image is from the anterior surface of cornea, and third is from the anterior surface of lens. It's a good idea to wash the visco from behind the lens if you are using dispersive viscoelastics while loading. And many times visual axis is a bit nasal to center of pupil. So slight nudging the lens nasally or a bit rotation of the lens does the trick of centration. And post-operatively, patient had 6/6 uncorrected vision for distance. For near, at around 35 centimeters, she was N6. At around 70 centimeters for intermediate, she had N8 vision. And if we look at the defocus curve on the right side of triphobic HD, it shows 3 humps for distant, intermediate, and near. The dip which we get on bifocal lens for intermediate range is definitely gone here. And to conclude that I would say that triphobic HD gives excellent distance and near vision if your biometry and surgical technique is perfect. and it gives improved intermediate vision compared to bifocals. Glare and halos are there, but still they are less bothersome than the traditional bifocal lenses. And there is definitely a happy patient post-operatively if you have selected the right patient for the surgery. Thank you. I think